And the big rage now is fat. You have surgeons putting in fat right and left all over the face. I do not put fat anywhere else in the face because fat is guaranteed to be irregularly irregular. You can put the same amount in this side and have the same amount in that side and have two different cheeks. It is easy to put fat in. It's almost impossible to get fat out because it's put usually within the tissue, and you have scar tissue. When you try to remove it, you never get it removed. And I have every day patients send me photos saying, what can you help me with here to reverse this? Very often I'm asked about what to do about either the bone or the masseter muscle here. I never recommend removing the bone, which will then make you look disproportionate, where the upper 2/3 will look much, much larger, and it creates an abnormal angle of your jawbone. I recommend using Botox and not resection of the masseter muscle, which can cause problems. Botox lasts anywhere between 3 to 5 months, depending on the individual. So 2 or 3 times a year is what people normally do for masseter muscle hypertrophy. The same procedures that I do on transgendered patients, I use for cisgender patients as well. Forehead lifting with or without bony orbital contouring. Very often they need a thyroid cartilage shave. They may need, obviously, aging surgery, but cheek implants, forehead lifting, nasal surgery, these are the same, though I do them somewhat differently for cisgender versus transgender. Hi, I'm Dr. Mayer. I'm talking today about how we do a thyroid cartilage shave. I began doing these 45 years ago and have done hundreds by now. It involves making an incision very high so it isn't seen, and then removing this cartilage on both sides down to the lower third of the thyroid cartilage. If people have a bump extending lower than that all the way down, that bottom piece I have to leave because the vocal cords are attaching there. And if you were to separate those, you'd end up with no voice. But most patients have all of this excess, the prow of a ship, well above the vocal cords, and we just shave that flat and we're done. A hairline can be advanced depending on what's causing it to be in a poor position, or if the scar is great because it wasn't closed properly. All of these can be revised with a good result. Botox is a cheaper alternative for slimming this, since I'm a surgeon who does not like removing this area of the jaw because I feel it unbalances the way the patient looks. It is not proportionate, and therefore they are misgendered. A nose can be done independently of forehead contouring. It makes no difference which goes first. A brow bone reduction on a cisgendered male will not make the nose appear appreciably smaller. Nasal surgery for most transgender patients is important because it's a male nose and you want a female face. So if you have a great looking female nose, you don't need a rhinoplasty. So Most patients are going to want a rhinoplasty because it makes a big if they have a male nose, it's going to make a big difference. The upper third and the nose, in my opinion, and the voice. Those are the three big ones that you can't get around. And of course, with the voice comes the thyroid cartilage shave. You can do orbital rim contouring endoscopically. You can do a forehead lift endoscopically, but you can't lower the hairline endoscopically. So to achieve those, all three of those, the best procedure is still the one that I invented almost 50 years ago, the irregular trichophytic forehead lift with orbital bone contouring and hairline lowering. If I'm seeing a patient who has a very low hairline and they need orbital rim contouring, I can do that through an endoscopic approach. Very often transgender patients have had either liposuction in their neck, and you get to a certain point, usually after 30, if not before, depending on how much weight loss, where you end up with a turkey gobbler. And the only way to get rid of a turkey gobbler is not with like radio frequency and we're going to do all these little things. No, you need a facelift for that. You get a little tiny bit and you want a tiny result, but patients end up getting these other minor procedures and they say, no, I still have a turkey waddle. Excess skin needs to be removed with a facelift. That's why I've had a facelift. People in my family have had a facelift because that's how you get rid of excess skin and excess fat. Patients often who have what's known as a horse face, a long face that is too long, benefit from having that mid-face shortened. If that's you, you're better to have that done first, and that's usually done by an oral surgeon. You have to have your jaws wired for about 6 weeks. And that gives fantastic results when patients actually do have a horse face. Not where you're getting out a micrometer, going, oh yeah, that's like 3 millimeters more than it should be. No, we're talking about something significant. Then it's worth having that operation because it can give outstanding results.
Hi, I'm Keely, Dr. Mayer's surgical coordinator. Very often, patients ask us if they can use insurance to pay for their procedures with Dr. Mayer. While we do not contract with any insurance company, we do work with insurance. So this means that if you have out-of-network benefits, we will submit your codes for pre-authorization. Once they're approved, you would pay the balance of surgery to us up front, and then we would bill your insurance company payable to you on the back end. We also have experience working with letters of agreement. So what that means is if you work for a company that offers a supplemental insurance plan, we would work directly with your insurance company to contract the payment, and you would not be responsible for any of the fees, which would include the provider's fee, anesthesia, and the operating room fee.
Patients will often ask me that the voices they hear on my website, they sound a little raspy, and usually it's because they've just had their voice done the day before. So they can talk right away, but because of swelling, it's going to sound a little raspy or even hoarse from the day before. But you can see that after a longer period of time, I've never had patients have a problem with hoarseness or raspiness of their voice.